Windshield survey by Shannon, Madison, Denise, and Jeremy. Community core. The community around Neighborhood Health Center is distinctive in a way which shows two divergent Americas of poor and wealthy in just walking distance. This location in Buffalo, New York is one of the most diverse areas with a very short radius distance of 10 miles. Both neighborhoods are very distinguishable, but they both unconventionally share the same social and economic community.
Physical environment. The physical environment is very diverse. It's split between the impoverished or poor and the rich. Within the poor, there are public housing buildings and communities, impoverished buildings and houses, homeless shelters, community-based clinics, and many of it can be attributed to the decreased upkeep on rental properties. Within the rich, there are modernized buildings and houses, private practices, and high-end bars and restaurants.
There are many education opportunities near the Neighborhood Health Center on Niagara Street. The schools include the Buffalo Public Schools, number 73, number 304, which is Hutchinson Central Technical High School, and number 76, Herman Baldillo Community School. There are also many collegiate opportunities such as Erie Community College, City Campus, and Duville College. For safety and transportation, we were lucky enough to interview Jackie McCarthy, who works for the District Attorney's Office as an assistant crime analysis. For safety, the Neighborhood Health Center is located in B District of the Buffalo Police Department. B District is broken up into 4 sectors and covers just over 5 miles. The Neighborhood Health Center is located in Sector B4. Between November 1st, 2018 and January 31st, 2019, there were 457 Part 1 crimes. Part 1 crimes include murder, which there was 2, rape, there was 6, robbery, 32, assault, 57, burglary, 41, larceny, 294, and motor vehicle theft of 25. As for transportation, there's the NFTA. The NFTA provides a plethora of bus stops throughout the city, as well as a metro rail system. Politics and government. The Honorable Byron Brown was re-elected for his 4th four-year term as mayor of Buffalo in 2017. He is the first African-American mayor of Buffalo. Byron Brown has made a remarkable impact to the city of Buffalo and has resulted in a nearly $6.5 billion new economic development, with activity of over 12,000 new jobs to the area. He continues to carry his mission of creating a thriving, healthy, and innovative Buffalo. David Rivera is the councilman member of the Niagara District. He previously worked as a Buffalo police officer for over 25 years. Here's a quote that I have pulled from an interview that he had about Refugee Day. I am a public servant. I am accountable for the general public, and my job is to serve you. I get calls on a daily basis from people from all over the world regarding housing, regarding police matters, and language barriers, and fair housing/affordable housing. I get all those calls, especially from the immigrant and refugee community, now that they know that I'm here to serve. They know I'm here to serve, and when I first started here, they wouldn't even come to my office because government was seen as part of the problem. Where they come from, government was the oppressor. So when they moved here, or when they came here to the United States, we kind of let them know, hey, we're here to help you. We're here to serve you. And I am accountable to you. If I don't do a good job, then kick me out. That is to show me that you're unhappy with me. With the high refugee and immigrant population in the Niagara District, Councilman David Rivera is a great advocate for our community members.
Health and social services. Within the area, there are plenty health and social service facilities. Just to name a few, there's the Lakeshore Behavioral Health Center, Evergreen Health, Will Care, Interim Health Care. There are several pharmacies within the area, including Rite Aid, Niagara Pharmacy, and Tops Pharmacy, Catholic Charities, U.S. Health and Human Services Department, and Erie Regional Housing Development, just to name a few. Many of these are within walking distance from the Community Health Center. Communication. There are a variety of languages spoken around the area. The Neighborhood Health Center has a total of 16 spoken languages from the patients they received. The Hispanic community is one of the largest cultural groups in the northern area.
Economy. The economy for the 14201 area code is as listed. So the per capita income is $22,748. The median household income is $27,369, and 35.8% of the people in this area live below the poverty line. There's 5,614 households. There's 6,442 number of housing units. The median value of the houses is $160,100, and 21.8% people in the area moved since the previous year. All of this information was pulled from the U.S. Census Bureau.
Recreation. Within the area, there are plenty of things to do. There's the Barkyard Off-Leash Dog Park, which is located on the Lake Erie waterfront. Lake Erie waterfront and canal side, which hosts plenty of events, along with Veterans Park. Erie Basin Marina Observation Deck. Buffalo Charter and Miss Buffalo. Buffalo History Tours, which both offer sightseeing tours. Kleinhand's Music Hall. Allentown, which is a plethora of bars and restaurants. Babeville and Town Ballroom, and Shays Performing Arts Center, which all host live events. Strengths of the community. The community is very diverse. There's a variety of individuals with different race and ethnicity living or commuting within the area. Social economy diversity between the neighborhoods of the wealthy and the poor. Business economic diversity, which is a variety of mix of businesses. There's plenty of healthcare facilities, and as I've stated, many of which are within walking distance. Weaknesses of the community. There's an increasing wealth inequality, where wealthy neighborhoods are getting richer and the poor neighborhoods are becoming poorer. Long-term health effects. Living in a poor neighborhood where access to proper treatment is difficult due to income and illegal status. The communication barrier can be difficult for those who speak a language that's not prevalently spoken within the area. A few nursing diagnoses include ineffective self-health maintenance related to lack of financial and material resources, impaired home maintenance related to existence of disease, inadequate support systems, and deficient knowledge related to information misinterpretation and unfamiliarity of information resources, and readiness for enhanced hope related to expectation, desire to get better.
Planning for community health care. After our assessment of the community, we compared it to the goals, needs, and interventions listed on the Healthy People 2020 website. A common primary health need for our community and for Healthy People 2020 was nutrition and weight status. So a goal we have for our community is to promote health and reduce the risk of obesity-related disorders through the consumption of healthy foods and achievement and maintenance of a healthy body mass index. Now, to achieve our goal, we would do it through several interventions. Our primary interventions would be education classes on exercising, how to create food diaries, and what a healthy diet is like. Our secondary interventions would be blood pressure screenings to assess for hypertension, measuring body mass index to see if they are overweight or obese, and A1C, fasting glucose, cholesterol, lipid panel, and ALT screening to assess for any health-related disorders to obesity. And our tertiary interventions would be management of obesity-related health disorders, exercise programs to help not manage their obesity and not have them progress, healthy cooking classes to ensure that they're eating a healthy diet and to prevent the disease from obesity to progress, and medications to manage their high A1C levels, cholesterol, or lipid levels. In conclusion, through our Windshield survey and community assessment, we have gathered information and data regarding preparedness, available resources, and needs impacting and influencing this community's ability to promote health and well-being among the vulnerable population. Here are our references.